A no scalpel vasectomy is a local anaesthetic procedure which takes about 10 to 15 minutes to do under local anaesthetic. What it involves is we numb the skin at the front of the scrotum, and then once that's numb, we just make a small hole just a few millimeters. That allows us to go in, find the tube on each side, one from each testicle that carries the sperm, the vas. The vas goes up to the seminal vesicle, which sits below the bladder, and the vas carries the sperm from the testicles. So if we divide that, it stops the sperm from traveling up. Only about 2 to 5% of the volume in ejaculation comes from the sperm. The vast majority comes further upstream. So sexual performance in men is maintained. They still continue to ejaculate as normal. It's just there's no sperm within it, and therefore the man is infertile. Any man can have a vasectomy as long as they're certain they don't want any more children. There is no age restriction, and usually it's men who have had a few children or one child, but some men don't want any children, and that's perfectly acceptable as long as it's a decision that you're comfortable with and you're certain that your family is complete or you never want children. That's fine. The main reason not to have a vasectomy or to delay a vasectomy would be that you're not sure that your family is complete. So if there's any uncertainty, then it probably isn't the right decision for you at this time. A vasectomy is a fantastic choice if you're certain your family is complete. It's a non-hormonal method of contraception. It only takes a few minutes to do, and it's a permanent form of contraception. So if you're happy that you want a permanent form of contraception that doesn't involve any hormones, then this is a fantastic choice. But if there are any doubts, then perhaps it isn't right for you at this time. I usually perform vasectomies on Thursdays or Fridays. That usually allows men to have a couple of days recovery, doing very little, just light duties. And then if you have an office-based job or a job that involves light duties, you can usually go back to work after a couple of days. If you have a heavy physical job, then we usually advise a few days off. And then if you want to go back to doing the gym or exercise, we usually advise about 10 days to 2 weeks. Once you let everything settle down and then allows you to be comfortable. The key with recovery to vasectomy is not to overdo it in the short term. As long as you take it easy, the recovery is usually very straightforward. There are about 500,000 vasectomies done annually worldwide, so it's a very popular procedure, but there's always risks with any form of medical procedure. So there are some short-term risks. Those would be risk of wound infection, which is well below 1% for my personal figures. There's a small risk of bleeding into the scrotum, which is about 1 in 400, which is why it's not important to not lift any heavy weights too soon after the procedure. In terms of long-term risks, there is a small risk that you might get an ongoing discomfort in the testicles. This is reported about 1 in 2,500 men, and there is a small risk that the tubes can rejoin. We test you at 16 weeks after the procedure to make sure you're sterile. If you're sterile, then there is a very small risk that following that, about 1 in 2,500 men, the tubes can rejoin up to 25 years afterwards, but this is a very rare risk. On the whole, vasectomy is a safe procedure, a local anaesthetic, the recovery is very quick, and an excellent choice for a man who's certain that his family is complete.